This session is about empowering patients and in their collaboration with their physicians, and that's basically what I do, both in my life and in my work and research. So it was irresistible to me. One of the key aspects of being an empowered patient is to have both access to your data and understand what it means, and then open notes and that kind of methodology where you have access to your clinician's notes as well as your test results and lab results and what have you, is really a key aspect, a key feature of a system that will work to empower patients in a good way. I think that what is important, what I've understood that people think is important in my presentations is that I show the power of data and how even without being actively supported by healthcare, patients can do a lot for themselves. In that I have actually optimized my own medication effect by learning about my individual responses over time and being able to empower myself very effectively that way. I mean, this place is just amazing. It brings together great minds, great thinkers, great people with amazing experiences and amazing stories to share from all over the globe to a place that's probably more like paradise than anything else on Earth. I mean, this is just an amazing event and an amazing place to be. And it's very, very apparent that the team is also working very hard to design these sessions, because it takes a lot of work to make something seem this effortless. Yes, this session is different from the one I was in 2 years ago here, in that there are more patients in this one, and I think something happens in the room with that. There's a special atmosphere that comes from having, if you may, real patients in the room, and not just one as at my previous session, which I'm fine with that, but there's power in numbers, and to hear the stories of other patients over lunch, over coffee, and at the sessions makes me understand even more about what we need to do to see this through and make the world see a new kind of healthcare system. When it comes to, on a broader scope, the effects and the importance of openness and transparency in healthcare, as well as in other areas of the society, I think it cannot be overestimated how important it is that people start using it for themselves and not waiting for others to do it for them. It provides the foundation that I think will be the new healthcare system that we need.